3 abstracts that all represent registry studies. And we try to make health research. You can do it either prospectively or you can use data that are already available in some sort of registry. In Denmark we have had a quite unique chance to do the last for many years because of a very good and comprehensive registry system which has been envied by many countries in the world who visited us to have, for example, access to our Twin Center register that is quite unique. And unfortunately, over the last decade or more, the reinforcement of privacy laws have has a negative effect on the possibility for us to use these data, even though they are anonymized. And I therefore want to stress the fact that it's extremely important for us in, for example, a discipline as neurology, in which we have often quite rare diseases and also diseases that progress over very many years, that we have access to this sort of information and can use it without restrictions as long as it's within ethical borders. Am I to? Yes. Of course we have, I forgot this slide, we have quite good representation of Danish abstracts, which is not that odd because we're in Copenhagen and we have tried to have all persons of the hospitals this event. This study is one of the ones I picked from the 100, and it's very interesting that we have known for many years that pregnant women with epilepsy on certain drugs had a considerable risk to have malformation in their children. And what has not been known is that patients with the pregnant women having what is obviously normal babies still have a risk of these babies being developing differently and less fast in their childhood. And it's only possible by these registries to show these differences. It would never be able to make a study like this prospectively. So the exact outcome of this study is that we have to be very, very concerned of what we are treating pregnant women with epilepsy with, and be very sure that we continue to have a high awareness of this problem. Another field where epidemiologic research is very fruitful is migraine. After we began to make MRIs on patients, it became obvious that patients with migraine, especially those with aura, had a higher presence of white matter lesions, of which we didn't really know what was the significance. But year after year, new studies with the quality that is not really in the top control have indicated that there was in fact a reason to expect this to be ischemic lesions, small subclinical ischemic lesions. And it became an increasing worry that patients with this disease in fact had strokes, minor strokes that could develop and sum up to something with a worrying consequence. And maybe should maybe be treated. This study was made in Denmark to solve this issue, and the they are in a very strong way able to document that there's no such things as minor strokes in or increase in the incidence of minor strokes in patients with migraine with aura. So definitively we can give up that theory and that myth, and it's quite nice for the patients to know, and it's nice for us to know that if we see a lot of white matter lesions in migraine patients, we should take it seriously, but make a workup of the condition in a different direction. The last is an example of a quite rare disease, but even though of the hereditary neurologic diseases with a high prevalence, the Charcot-Marie-Tooth disease, peripheral nerve disease, progressive, and it's so slowly progressing that it's very hard to know exactly what is the long-term consequences. We know that they're disabled in some way, but we don't know really their life expectancies. By using the Danish registries and a new way of looking at the methodology, this group has been able to show that there's a significant shortening of their life expectancy. You could say, what are the consequences of that? Well, it's partly that we can have a better counseling of the patients and the families, but also that this is an opening of the methodology that should hopefully be able to be sustained in society, and that the society have the advantage of all these data in the future.